Have you ever woken up, turned your head to the side of the bed, and suddenly felt like the entire room was spinning? That morning dizziness that not only ruins your day, but makes you question whether there's something seriously wrong with your health. If you're over 45 and suffer from frequent dizziness, especially when waking up, you need to understand something crucial. The movement you make right when you wake up could be silently making your condition worse. But before you start fearing the worst, I have surprising news. A simple adjustment in your morning routine can drastically reduce these dizzy spells. And the first item on our list today is going to completely change the way you understand your dizziness. As a medical doctor specializing in vestibular disorders for over 20 years, I've seen an alarming increase in patients complaining of dizziness and vertigo. The statistics are impressive. About 40% of people over 50 will experience some significant episode of dizziness, and that number rises to nearly 70% after age 65. And what's most concerning, according to recent data from the Mayo Clinic, approximately 85% of these people are making their condition worse, with improper morning movements that could be easily corrected. Today, I'm going to share with you the 5 morning movements that most harm people with a tendency toward dizziness and vertigo, especially those related to the inner ear, and how you can adapt your routine to drastically reduce these unpleasant symptoms. Many of my patients have achieved surprising results in just 3 to 5 days of adjustments, even after years of suffering from dizziness. Let's start with the 5th most harmful movement, which many people do every day without realizing the damage they're causing to their balance. The 5th morning movement that can significantly worsen your dizziness is waking up abruptly with loud alarms. This seemingly harmless habit causes a sudden disturbance in the vestibular system, especially in people with sensitivity in the inner ear. Rosa, a retired 68-year-old nurse, came to my office after 3 months of recurring dizziness that started right in the first moments of the day. "Doctor, it's like the world starts spinning as soon as the alarm goes off. I'm scared of falling when I get out of bed," she reported, visibly distressed. After a detailed analysis of her routine, we identified that her extremely loud alarm clock was triggering a startle reflex that directly impacted her balance system. What happens scientifically is fascinating. When we're exposed to a loud and sudden sound, our body releases a surge of adrenaline as part of the fight or flight response. This hormone causes temporary constriction of blood vessels, including those that supply the labyrinth of the inner ear, our natural gyroscope. In people predisposed to vertigo, this sudden change in blood flow can trigger an imbalance in the hair cells of the inner ear, resulting in a sensation that the environment is spinning. The solution we implemented with Rosa was surprisingly simple and effective. We replaced her traditional alarm with a gradual light alarm clock that simulates sunrise, gently increasing the room's brightness for 30 minutes before the scheduled time. This change allows the body to wake up naturally, without the shock that triggers the mechanisms that cause dizziness. "Doctor, I never imagined that something so simple could make such a difference. Mornings are now a peaceful time without that terrible feeling that I'm going to pass out at any moment," Rosa shared at our follow-up appointment 3 weeks later. It's important to mention that people with labyrinthitis or positional vertigo should avoid any intense sound stimulus as much as possible in the early morning hours when the vestibular system is particularly vulnerable after the nighttime rest period. In addition to the light alarm clock, I also recommend keeping the volume of electronic devices at moderate levels in the morning, and considering the use of soft earplugs during the night if you live in noisy environments. This simple adaptation can silently transform your mornings from moments of dread to experiences of balance and calm. Now, let's explore the 4th problematic morning movement, which many of my patients do without realizing the negative impact on their balance. The 4th movement that frequently aggravates morning dizziness is getting up quickly from bed, especially after a night's sleep. This sudden movement can trigger what we call orthostatic hypotension, a sudden drop in blood pressure that temporarily reduces blood flow to the brain and the vestibular system. João, a 65-year-old former bus driver, came to my office after suffering a frightening fall when getting out of bed. "Doctor, it was like the floor had disappeared from under my feet. One second I was getting up, the next I was on the floor not understanding what had happened," he said worriedly. João had been diagnosed with benign paroxysmal positional vertigo (BPPV) a few years ago, but his symptoms had worsened significantly in recent weeks. After careful investigation, we discovered he was taking a new blood pressure medication before bed, which intensified the drop in blood pressure in the morning. From a scientific standpoint, when we lie down for several hours, blood is distributed evenly throughout the body. When getting up abruptly, gravity pulls this blood downward, especially to the legs, causing a momentary reduction in blood flow to the brain and inner ear. In individuals predisposed to vestibular problems, this hemodynamic change can trigger or intensify symptoms of dizziness, vertigo, and even trigger the movement of otoliths, small calcium crystals in the inner ear that are loose in BPPV. Imagine like small stones loose in a shoe that move when you take a sudden step. The approach we implemented with Joe involved a simple but powerful change in his morning routine, adopting the 3-2-1 technique, which consists of taking 3 deep breaths while still lying down, moving slowly to a sitting position on the edge of the bed and remaining that way for 2 minutes, and finally standing up while leaning on a stable surface, counting to 1 minute before starting to walk. Doctor, this technique changed my life. It seems so simple, but it made a huge difference. I haven't had any more severe dizziness episodes since I started practicing it. Joel reported at his follow-up appointment. It's important to note that people taking blood pressure medications, diuretics, or muscle relaxants should pay extra attention to this morning movement, possibly adjusting the timing of these medications after medical consultation. I also recommend keeping a glass of water on the bedside table and drinking before getting up, which can help stabilize blood pressure. This seemingly small habit change can have an extraordinary impact on preventing morning dizziness and possible falls. Now, let's continue our journey to the third morning movement that could be sabotaging your balance without you realizing it. The third morning movement that can seriously compromise your balance is what I call digital overstimulation. Immediately reaching for your cell phone to check emails, messages, and social media as soon as you open your eyes. This extremely common habit in our hyperconnected society has a devastating impact on the vestibular system, especially in people over 50 ANI. A 61-year-old marketing executive came to my office after months of progressive worsening of morning dizziness. Doctor, I feel like my head is going to explode. The room spins. I feel nauseous. And the worst part is that it takes hours for me to feel minimally functional, she described, clearly exhausted. After a detailed assessment, we discovered a disturbing pattern. Anna spent the first 45 minutes of her day lying in bed scrolling through her phone, starting with work emails, then checking news and social media. This habit, which she considered productive and part of her morning efficiency routine, was actually the main trigger for her symptoms. The science behind this is both fascinating and alarming. When we immediately expose ourselves to the intense blue light from screens, we create what I call a sensory conflict. Your body is still transitioning from the sleep state to wakefulness, and the vestibular system is recalibrating after hours of horizontal rest. Blue light suppresses melatonin production abruptly and stimulates cortisol release, while the visual system is forced to focus and refocus rapidly on small moving texts and images. This combination creates a sensory mismatch. Your eyes are sending signals of rapid movement to the brain as you scroll through content, but your vestibular system is still signaling that you're stationary and horizontal. This conflict between visual and vestibular information confuses the brain's balance centers, particularly in the cerebellum and vestibular nuclei, resulting in the sensation of dizziness and, in more severe cases, nausea and disorientation. It's as if your internal GPS is receiving contradictory coordinates simultaneously. The intervention we implemented with Anna was what I call the 30-minute screen-free zone, a sacred period in the morning where she commits to not touching any electronic device. Instead, we created a gentle transition routine, sitting on the edge of the bed for 2 minutes while doing slow eye movements, looking right and left, up and down without moving the head, then getting up and doing some gentle stretches, followed by hydration with water, and only after this complete sequence, about 30 minutes after waking, checking her devices. Doctor, this was the hardest change to implement because my mind was programmed to check messages right away, as if the world would collapse if I didn't. But the results were so dramatic that after the first week, I wouldn't trade this new routine for anything. The morning dizziness practically disappeared, and I feel so much clearer and more focused throughout the day. Anna shared at our 1-month follow-up consultation to implement this strategy. I recommend setting the alarm and immediately placing the phone in a drawer or in another room, making access more difficult and forcing you to get up to turn it off. This small friction in access helps break the automatic pattern of reaching for the device. If you absolutely need your phone as an alarm, use airplane mode or do not disturb features to avoid the temptation to check notifications. This seemingly simple change in your digital behavior can have a profound impact not only on your vestibular symptoms but on your overall mental health and sleep quality. Now, let's move on to the second most harmful morning movement, which many people do believe in they're doing something healthy. The second morning movement that can significantly aggravate dizziness is what I call the twisted awakening. Turning your head abruptly from side to side while still lying down, whether to look at the clock, check your phone, or simply change position in bed. This movement, though seemingly innocuous, is particularly problematic for people with vestibular conditions. Carlos, a 57-year-old retired accountant, came to my office visibly scared after waking up with such intense vertigo that he couldn't get out of bed without vomiting. "Doctor, I thought I was having a stroke. The room was spinning so violently that I had to call my wife to help me get to the bathroom. It was the worst experience of my life," he described, still shaken. After a thorough investigation, including tests and a detailed questionnaire about his morning habits, we discovered that Carlos had a routine of checking the time on his bedside alarm clock multiple times during the night, and especially in the morning, a habit that involved abrupt head rotations while still lying down. The physiology behind this problem is directly related to how our inner ear, specifically the semicircular canals, processes rotational movement. When you turn your head suddenly while lying down, the fluid inside these canals, the endolymph, moves rapidly, bending the hair cells that detect movement. In people with conditions like BPPV, Meniere's disease, or vestibular neuropathy, this rapid movement can dislodge calcium carbonate crystals, otoconia, that should be attached to the gelatinous membrane of the uterus. When these crystals break loose and move into the semicircular canals, they create abnormal signals of movement that don't correspond to reality. It's as if your brain is receiving information that you're spinning violently when you're actually just lying still. This sensory mismatch is what generates the intense sensation of vertigo. The solution we developed for Carlos was the en bloc movement technique, the principle that the body should move as an integrated unit, especially in the first movements of the day. Instead of turning just the head, we taught him to turn his entire body, keeping the head aligned with the torso. When he needed to check the time, instead of turning his head abruptly, he would roll his entire body to the side in a slow, controlled manner, or simply move his arm to bring the clock to his field of vision without moving his head. "Doctor, this may sound silly, but this technique literally gave me back control of my life. I went from living in fear of the next vertigo episode to being able to wake up confident that I'd have a normal morning." The difference is night and day. Carlos shared emotionally at our 2-month follow-up. For those who want to implement this strategy, I recommend placing a visual reminder next to your bed, something like a note that says "move as one unit," to help create this new habit. Also, position clocks and essential objects within your field of vision so you don't need to rotate your head to see them. If you wake up during the night, take a few seconds to breathe deeply before making any movement, allowing your vestibular system to fully stabilize. This conscious approach to body movement can be transformative, especially for people who have been living with chronic vertigo for years. Now, let's move on to the most harmful movement of all, the one that, when corrected, produces the most dramatic and rapid results in my patients. The first and most harmful morning movement that can trigger or dramatically intensify dizziness is what we call the first hydration error drinking. Coffee or other stimulant beverages as the first intake of the day before properly rehydrating. This practice, extremely common in our society, has a profoundly negative impact on the vestibular system, especially in people predisposed to dizziness. Maria, a 58-year-old retired teacher, came to my office after a full year dealing with debilitating morning dizziness that was severely affecting her quality of life. "Doctor, I've already consulted 3 neurologists and had every possible test done. Nobody found anything wrong, but every morning, it's like I'm on a boat in rough seas during a storm," she described desperately. After a thorough analysis of her routine, I discovered a revealing pattern. Her symptoms worsened significantly on days when she consumed her strong cup of coffee even before getting out of bed, a habit she considered harmless and even healthy. The science behind this phenomenon is surprisingly clear, although rarely discussed even among health professionals. During sleep, our body goes through a natural dehydration process that affects the viscosity of the endolymph, the fluid present in the labyrinth of the inner ear. This overnight dehydration subtly alters the density of this crucial fluid for balance, making it thicker. When you introduce caffeine or other diuretic substances before properly rehydrating the body, you create a double negative impact. First, you accentuate the already existing dehydration, further increasing the viscosity of the endolymph. Second, caffeine stimulates the central nervous system and increases blood pressure, causing a vasomotor response that can temporarily alter blood flow to the inner ear and brain areas responsible for balance. It's like trying to calibrate a precision instrument using irregular tools. The result is inevitably imprecise and potentially harmful. The intervention I implemented with Maria was what I call the vestibular hydration protocol, starting the day with 300 to 400 milliliters of room temperature water, never ice cold. As extreme temperature can stimulate the vagus nerve and potentially trigger dizziness, ideally with a pinch of unrefined sea salt to help with absorption and electrolyte balance. Only 20 to 30 minutes after this initial hydration, could she consume her coffee or tea? Doctor, this seemingly simple change completely transformed my life. In the first 3 mornings, I didn't notice much difference, but from the 4th day on, it was like a new world opened up to me. I can get up without fear, drive again, and I've regained the confidence I had lost. Maria shared, visibly emotional at our 6-week follow-up consultation. To implement this strategy in your routine, keep a water bottle next to your bed and make water consumption your first conscious action of the day. Wait actually at least 20 minutes before consuming any caffeinated, sugary, or alcoholic beverage. People with a history of kidney or heart problems should consult their doctor about the ideal amount of fluids and electrolytes. This simple adjustment in the morning hydration sequence can have a profound and lasting impact on reducing the symptoms and provide what so many of my patients describe as a liberation from the prison imposed by chronic dizziness. The journey we just took through the 5 most harmful morning movements for those suffering from dizziness reveals a powerful truth. Small adjustments in your daily routine can have a transformative impact on your quality of life. As we've seen, from waking up abruptly with loud alarms to the first hydration era with caffeine, our seemingly harmless habits may be silently sabotaging our balance. The most important thing to understand is that dizziness is not a condition you need to accept as a normal part of aging or as a life sentence after a diagnosis of labyrinthitis or vertigo. In my experience, treating thousands of patients over 2 decades, I've witnessed truly extraordinary transformations when people implement these simple but profoundly effective changes. Remember Rose's story, who replaced their loud alarm with a gradual light alarm clock. Joe, who adopted the 3-to-1 technique to get out of bed. Anna, who established a screen-free zone in the first 30 minutes of the morning. Carlos, who learned to move his body as a unit to protect the vestibular system. And Maria, who completely transformed her morning experience just by changing her hydration sequence. Which of these 5 adjustments will you implement first in your morning routine? Maybe the vestibular hydration protocol, starting the day with water instead of caffeine. Or maybe the conscious movement technique, rotating your body as a unit to protect your vestibular system. Share in the comments which strategy you believe will make the most difference in your life. If this content was helpful to you or someone you know who suffers from dizziness, please give this video a like and subscribe to the channel for more information that can literally transform your relationship with your health. Remember, dizziness doesn't have to control your life. With these simple but powerful changes, you can regain not only physical balance, but also emotional balance, taking back control of your mornings and consequently your days. As I always tell my patients, your body has an incredible capacity for healing when you work with it, not against it. These natural strategies are exactly that, a way to work in harmony with your body's natural balance mechanisms.